Now, a viewer from Candy, Ojai, Minnesota, not too far from Wilmer, wants to talk about taxpayer support of nursing homes, wants to know what's going on there in this session, and also wants to know, why do we set wages in nursing homes in St. Paul? And so let's talk about nursing home funding. Who wants to start with it? Senator Hand, should we start with you?
Well, there was a significant amount of funding for nursing homes. It was in it was part of the House agenda. I guess they really made a commitment to trying to do some things for rural Minnesota, and not just rural Minnesota, but nursing homes in general. And I think it was about 138 million. So that's a significant amount of money. And I guess the question of why do we do it in St. Paul, I think it has to do with the fact that we have regulations about nursing care, and if a person is going to qualify for a nursing home, then we do the funding, and so that translates into. I don't think we don't set their wages directly, but we do control the amount of funding that goes into the nursing homes, from which they have to figure out how to pay the people. And most of the folks in nursing care are there because they're getting some kind of support either from federal or state programs. So there are just limits to that money, and that translates into limits on how much people get paid.
I mean, the interesting thing about and it was, I think it was one of the highlights of the session that this nursing home reform went through. Mm-hmm. One of the interesting things about it, though, are people that private pay, so that they're not supported by, they're not on Medicaid for their nursing homes. Their rates are going to go up by the same amount, and some of these places rates are going up 40-50%. So some of those private pay, because of the way our laws work, and federal law, in fact, limits how much you can change it as well, are going to see 40-50% increases in the price they're going to have to pay at the nursing home as well. So that's going to be kind of an interesting twist on this. The other thing that's notable, though, is we limited our investment to nursing homes. So personal care attendants, people that work in group homes with people with disabilities, people that work in assisted living facilities, no new money went into that part of the system. So, we're also seeing a disparity a little bit in how we're funding different parts of our long-term care system.
And we did do 5% last year for the non-nursing homes. So, and that's a question. It was right, and you could argue maybe that's not enough, but like anything, there's always limits to what resources you have. And I think it's bipartisan. There are concerns about the level of funding that we're providing for elderly care. I think there's probably still more work to be done.
I would believe that was probably the most favored part of the Health and Human Services bill.
Sure.
That most everyone was very happy with it. Some people thought it was we had so many other needs that it maybe shouldn't have been quite as much money, but everyone is deserving. They're definitely deserving.
That and child protection, I think, was the other
child protection.
significant
That was huge.
change. Yeah.
That's great.